Hi, I'm Dove Sinclair with the Power of the Patient Project. My guest today is Dr. Paul E. Kaloostian. He is a board certified neurosurgeon and diplomat of the American Board of Neurological Surgery and fellow of the American College of Surgeons. He practices in Riverside and Los Angeles, California. Dr. Kaloostian attended medical school at the prestigious David Geffen School of Medicine at UCLA. He then attended the University of New Mexico Center of Neurological Surgery residency, where he excelled in cranial and spinal surgery, including neurotrauma. Dr. Kaloostian is a prolific author, researcher, and scientist, having authored over 80 peer-reviewed scientific manuscripts, over 130 book chapters, 12 peer-reviewed scientific textbooks, 2 poetry books, and 1 novel. Welcome, Dr. Kaloostian.
Thank you so much. It's really an honor to be here with you.
So, can you first tell us about your current medical practice in California and what your areas of specialization are?
Sure. I'm a neurosurgeon. I do both brain and spinal surgery. I treat patients surgically and non-surgically. Um, I do a significant amount of trauma coverage for one of the hospitals. That means that I take call overnight through the day and through the night, covering for whatever trauma patients come in, car accidents, assaults, etc. And I've been doing that uh, since um, since I finished med school. I really haven't taken a break from the field of trauma. It's really been one of the passions of mine in caring for these underserved patients. Um, Obviously, I do a lot of research. I have a couple of students I teach. Um, so that's essentially my practice in a nutshell. It's quite interesting. It's challenging, but very exciting.
Yeah. Why are you so passionate about it? Like, what really got you into, you know?
Yeah, yeah. I think, I mean, there's a variety of different reasons, I guess, personally, but um, I think neurosurgery is such a special field. I mean, you're seeing patients that really don't have anywhere else to turn for help. Patients with, as you can imagine, tumors, in the brain or in the spinal cord, or hemorrhages or bleeds in the brain, or bleeding in the spinal cord, paralysis. I mean, these are tough situations, and in most cases we can help if we do things appropriately and in a timely way. And um, and opening up the skull and seeing the brain, opening up the spinal cord and seeing the tissue of the spinal cord and the nerves, it's really very majestic, in my opinion. I think it's also very fragile in many senses of the word. So much can go wrong so quickly. Um, and it really takes a lot of energy and time and many years to hone in on how to be the best doctor for these patients. I think it's, for many reasons, quite an interesting field.
Hmm. Yeah, it definitely seems like an important one too. And as a neurosurgeon, you must not only be a skilled surgeon, but you have to be able to reduce the fears in your patients before and after
Mhm.
surgery. Luckily for you, you have a really good reputation about being a compassionate doctor. So, how do you uphold this patient provider relationship?
Um, I think that's a very important point, especially nowadays, Dove, when everything's so fast paced, and there are just so many patients out there. I mean, even now with COVID, just imagine our hospitals are flooded, and we need to help them. And I think I always talk about a few different points that I always think are important. Number one, sitting down with a patient. So versus a doctor standing up. So sitting down, I think you as a patient, I know myself as a patient, if my doctor's sitting down with me as opposed to just running around the room and trying to leave, I think that makes me feel more comfortable. So I think having the doctor sit down calms the patient down, and it tells me that, look, this doctor is here really to listen to me. The power of touch, I think, is very important. There's nothing worse than a doctor that doesn't even like look at you or touch you. I think that distances that relationship and makes the outcome worse. So I think physical examination is very important. So the power of touch, there's that energy transfer between two human beings, and it tells the patient, look, this physician or provider is really interested in finding out what's going on. He's examining me. He must care about me and wants to help me. Um, and then finally, empathy. I think empathy is very important. I think every so often it's important to repeat what the patient has told you, just so you convince the patient that, look, I am listening to you. I heard what you're saying. I understand what you're saying. Um, and I think that's a very positive point for the communication between the provider and patient.
Right. Yeah. Very important. And now you also write poetry books. So, what motivated you to put your thoughts and experiences as a doctor into such a poetic form?
Yeah. I've really enjoyed poetry as a means of expression, much like art, or I mean, some would say, rap and music and other forms of creativity. It's very powerful. It's moving. People are interested in it. They like it, and I think it is able to convey, a message that is trying to be sent across through that art. Um, and I think for me, poetry. Um, was a cathartic mechanism to de-stress myself, first of all, but also to show patients and the world really how courageous patients are. Ourselves, our kids, our parents, grandparents, they've all, been through health issues, and if not, they will, unfortunately, in life. Um, and I think we need to convey how powerful the human body is and how courageous patients are going through very difficult times. Oftentimes, people get sick and they go through so much, and it's like nothing is remembered about it. And it's sad, but it's like for that particular patient, that was a big struggle. Women with infertility, and what they go through, and there's so many patients with traumatic brain injuries, our military members who've lost limbs and who have PTSD. I mean, we shouldn't take that for granted, and we should appreciate what they've done and put them on a pedestal, and help them. So I think poetry was a means for me of conveying things in an easy to understand format. Um, and I know George Bush, the prior president, he painted. He now paints, and he's painted a book of military people who've either lost limbs or who've gone through battle, and so that's one art form. But for me, poetry was the way of expressing that.
Hmm. Is there anyone specific that you wanted to read your poems?
I wrote it for the world. I mean, it's not anyone in specific. It's for people who are interested in reading about the struggles of others. For example, my poems are about patients that I've seen. They're all true stories about patients that I've seen put in a poetic format, and they convey what that particular patient went through. Even pediatric patients I write about. For example, there's some pediatric patients that are born with craniosynostosis, which is an abnormally shaped head,
Mhm.
and it could be long ways or widthwise long, or so there's different variations of the shapes of a patient's head, and you know there's treatments for that, but it's also the I write about the family's thoughts about it and the family's desires to help their children. So there's a lot that goes into each and every single patient that I want the world to know about.
Mhm. Yeah. Well, it's a very unique form. I've never heard of a doctor writing poems, so great.
Thank you.
And finally, in your opinion, what responsibilities does a doctor have to his patients to help them navigate a sometimes very complex healthcare system?
Yeah, that's very true in this day and age. Well, I would say communication between provider and patient is critical. There needs to be that open communication so that the patient can feel comfortable in relaying thoughts and messages to the provider or his or her team,
Right.
and then vice versa. That needs to be present. There needs to be an understanding that no one's perfect either. Someone can do the perfect operation or take care of you perfectly, and yet you may still not have the ideal outcome. That can happen, and people need to be aware that we're humans treating other human beings. And um, it's not robots, at least not yet, treating other human beings. It's human beings treating other human beings, and nothing is guaranteed. But I think with knowledge by the physician, with experience by the physician, with communication between providers and patients, with empathy, and with developing a honest, trusting relationship, that outcomes will almost always be positive. So I think that's the best way I can explain it.
Right. Yeah, I completely agree.
Thank
That's all the questions that I have for you today.
you. Okay.
So, is there anything else that you would like to add?
No, I think that's it. Let me know if there's any other questions or concerns.
Okay, great. Thank you so much for joining me.
Sure. Thank you.